Hi, I'm Kirsten Batts, and this is my physical assessment 2 um, head to toe video. This is my husband, Jess Batts. He's going to be my patient. Is that okay by you?
Yes.
Okay, wonderful. So I'm going to make sure that I wash my hands before I start. Can you tell me what today is?
December 5th,
Okay, about what time is it?
10 o'clock.
Okay, great. So he is alert and oriented. His mood is good because I let him sleep in, so that's wonderful. All right. So the first thing I want to take a look at is skin, and um, he feels normal. I'm back of my hands, and he feels normal. His skin overall is intact and clean. Hair is dispersed over his arms evenly. I'm looking for any lesions or cuts. He does have a scar here. He does have a tattoo here, another scar here on his arm, and another tattoo as well here. And it looks like from injections from the Navy. As far as his face and neck, I don't see any lesions, cuts, or bruises. So before I start the actual physical hands-on assessment, is it okay that I touch you? And do you feel okay? Are you hurting anywhere? Any complaints at this point?
Yes, it's okay. No complaints.
Okay, great. So I'm going to look at his head first. His head is normal cephalic. Hair is evenly dispersed. No pain.
No.
No lesions. No lice or nits noted. His ears are midline. His nose is midline. His eyes are in the upper third. His nose is midline, like I said, and his mouth is in the lower 1/3 portion of his face. He does have some hair on his face because he hasn't shaved. Now, as far as sunspots, I do see a few. There is one here. I'd probably refer him to the dermatologist simply because it is not raised, but it is brown. It does have some irregular borders, just so that he could go ahead and get that checked out. And that would be important. Other than that, I don't see anything that's out of the ordinary. Okay, so the next thing that we'd like to move on to is his carotid arteries. Okay, normally you would take a look first to make sure that you don't see any bounding pulses. That's obvious. Next, you're going to palpate. You don't palpate them together, but separately. So his carotid pulse is strong and equal. Strong and equal. The next portion is where I would listen to it. Of course, I would use the bell on my stethoscope. I don't have a bell on this stethoscope because I'm as old as Moses as a nurse. This is my original stethoscope. But I would take the bell and I would listen. And you'd want to make sure that each side is strong and equal and there's no bruise or anything abnormal sounding. Okay. Very good. So then I'm going to move on to your eye exam. Got my pen light there. I'm going to turn off the light and inspect your eyes with the flashlight. So just need you to look straight ahead, okay? Keep your eyes open. Okay. His pupils do constrict. What we're looking for is pupils are equally round and reactive to light and accommodation. We're going to do the other side. And that's great. They do restrict and then they dilate back. Okay. Now the next portion of it is I want you to focus on this and watch it. Okay. And so his pupils do accommodate because I could see his eyes cross as he focused on it as it came to his nose. So pupils are equally round and reactive to light and accommodation. The next portion I'm going to take a look at is your nose. Your nose is midline. If you'll tip up for me, I'm just going to look for any abnormalities or blockages. And I don't see any abnormalities or blockages on either side. There is hair thinly dispersed. Go ahead. You've never broken your nose, have you?
No.
Yeah. I didn't think that I had seen anything, no deviated septum and no drainage. So what I want you to do is I want you to place your finger over your nose and breathe in through the other nostril. Any issues?
No.
Okay, try that on the other side. Breathe in. Great. Any issues?
No.
Okay, great. So everything looks intact with his nose. Next is his ears. His ears are midline. I'm going to take a look inside. Okay, great. His ears do look great. On the inside, I don't see any excessive drainage or any cuts or lesions in there. The outside of the ear is intact. No cuts or any kind of damage, any kind of pain when I palpate on your ears. Okay, I'm going to look to the other side. We'll look inside there. Great. And I don't see any abnormalities either there. And his ear is all intact with no lesions or cuts or bruises. All right. Now, the two things that I'd like to note that I don't have, but if I did, if I was in the hospital, if I had an otoscope, I would pull his ear up and back, excuse me, and take a look inside to look at the tympanic membrane. And it would need to be concave and kind of a pearlish gray. We'd want to see that, okay? Also, if I had an ophthalmoscope, I could look in to his eyes to see his lenses a little bit better and get a further exam on that. But neither of those two things do we have here today. So the next thing I'd like to move on is your mouth. If I'm looking on the outside, the lips are moist and pink. There are no cuts or cracking. So if you'll go ahead and open your mouth for me. Okay, great. His buccal mucosa is pink and moist. Lift your tongue up. Okay. I can see the vessels on either side, and it's pink and moist. Now I'm going to have you go, The uvula is midline, and I don't see any tonsils. Have you had your tonsils removed?
No.
Have you had your tonsils removed?
No.
You haven't. Okay, let me take a look again. I don't see any tonsils. Maybe you need to ask your mother. Because if you saw tonsils, you would be able to see them a little bit bigger. Although at this age, at 50, they might have retracted some. All right, so as far as that goes, then we're going to be moving on to the thorax. I wanted to take a look at his chest, okay? Normally you would do this with the patient with the t-shirt off, but here we're not going to do that today. His chest, the transverse diameter is 1 to 2, okay? It looks great. Chest expansion is normal. I don't see any barrel chesting. I don't see any concave chesting. Everything looks good here. Skin turgor, bounce back very quickly. So that's great as well. Now I'm going to have him move just a tidgy. There we go, perfect. Lean forward a little bit, and I'm going to feel for his spine starting at the top, going down. And I don't feel any curvature of the spine. You haven't had any issues with that ever, have you?
No.
Okay, great. So everything looks normal here. You can go ahead and sit straight up there again. The next thing I'm going to do is look for any tactile fermentus. So I'm going to have you say the word 99.
99.
And one more time.
99.
Okay, great. No tactile fermentus noted. Next thing we're going to move on to, perfect, you can stay just like that, is I'm going to listen to his lung sounds. This will be really important that I listen starting at the apex, all 10 regions, and then on the sides as well as the back. So it's going to be important for you just to take a deep breath in and then out. A little bit more inspiratory than expiratory. You breathe in a little more than you breathe out, okay? Okay, and then I'm going to listen here. Okay, then I'm going to move right around here to your back. You'll turn just a little bit. Go ahead. Okay, great. I don't hear any adventitious breath sounds. Everything sounds normal. You can just relax and breathe as regular. The next portion I would like to also do is the lymph system. We got 3 important things: lymph, lungs, and heart. So turn just a little bit like that. Perfect. Now, if I'm going to feel here, here's the pre-auricular lymph nodes. Here's the post-auricular lymph nodes. I don't feel any swelling on either of those. The occipital is back here. The tonsillar is here. The submandibular is here. The submental is here. Okay, on the outside here, we've got the superficial cervical. Okay, I don't feel any abnormalities there. The posterior cervical, no swelling there. And if you'll turn your head that way, the deep cervical there. Did any of that hurt?
No.
Okay, great. So I'm going to have you turn just a little bit more. I didn't feel any swelling or any abnormalities of his lymph nodes. So the next portion I'm going to do is going to be the heart, okay? And we're going to be listening to the aortic, pulmonic, Erb's point, tricuspid, and mitral. So the first here is the aortic. It's at the second intercostal space. Pulmonic, directly across, same spot, second intercostal space. The next one will be Erb's point, and that's around the third intercostal space. At the fifth is going to be the tricuspid, fifth intercostal space. And then the mitral is also at the fifth, but that's more midline. So we're going to listen here. Sounds good. Pulmonic. Erb's point. Tricuspid. And mitral. All right. Now, the next thing that I'm going to do is I'm going to listen to his apical pulse for 1 full minute. If you want to go ahead and get the timer ready. I did take his vital signs at the very beginning, and his blood pressure was 123/85, which is a little elevated, but it's pretty normal for him. Heart rate was 55, temperature was 98.1, and respirations were 18. So I'm going to see how this compares, listening to his, apical pulse for 1 full minute compares to what we took on our monitor. Okay, and here we go. Just let me know.
1 minute.
Now, okay. So his heart rate was 53, which is fairly close. That's about normal, and it's even and regular. As a side note, too, I was going to say, when listening to the heart sounds, if you want to listen for murmurs, then you're going to have to use your bell. So initially you listen with the regular portion of your stethoscope, and then to listen for any type of murmurs, then you would use the bell portion. But when I listened, I heard that normal lub-dub, lub-dub, lub-dub. So that is all good. I didn't hear anything that's out of the ordinary when listening. So the next portion is we're going to move over here, and we're going to do the abdomen and the peripheral vascular system. Okay, that's great. So if it's okay, I'm just pull this up. Perfect. So I'm going to go ahead and look at his abdomen, and everything looks normal. I don't see any cuts, any lesions. The skin is all intact. Hair is evenly distributed. His umbilicus is midline, which is great. So the first thing after inspection and everything is noted to be okay there, then you're going to want to listen to bowel sounds. Now we're looking for bowel sounds to be between 5 and 30 in a minute's time. Anything lower than 5 would be hypoactive. Anything greater than 30 would be hyperactive. So I'm going to go ahead and listen to the bowel sounds. You're going to start in the right lower quadrant. And you're going to do this in all 4 quadrants. He had about 12 sounds in the right lower quadrant. And in fact, when you listen there, that's going to be where you'll hear, where you're most likely to hear more vowel sounds than in the other quadrants. Okay, great. He does have vowel sounds in all 4 quadrants. The last thing would be the palpation of the abdomen, okay? And I'm going to palpate. Just let me know if I'm hurting you at all. If I feel here right underneath the rib, I'll be able to feel the liver. Also located in that area is the gallbladder. Also in this area is going to be the appendix. That can be seen on colonoscopy, the appendiceal orifice. On this side is going to be the stomach and the pancreas. And then, of course, your large intestines and then your small intestines. So we're going to move on to the peripheral vascular system. I'm going to go ahead and look at both of his hands. And it looks like his fingernails are neat and trimmed. I don't notice any clubbing. The angle is less than 160. And the capillary refill on both are less than 3 seconds. I'm going to look down here on his feet as well. I'm going to check the capillary refill here on these 3. That's great. I'm going to feel for both brachial pulses. And they're strong. Okay. Then I'm going to feel. Then I'm going to also feel for his radial pulses here. And both are strong. Then I'm going to feel for his dorsalis pedis right on top of the foot. Oop, there we go. You can't really see it there too well. There you go. Feeling on both sides. And he's got strong pulses there. All right. And then if I go around to the back by the ankle, then that's where I can feel the posterior tibial. And those are strong as well. Now on his legs, I don't see any swelling or edema. And I can check that there is no pitting edema. He does have some varicose veins, which I think you've had that for as long as you can remember. But stop short of that. Everything seems to be and look intact. So I wanted to thank you for listening. Oh no. I wanted to thank you for listening to our video, and thank you for your participation.
Thank you very much.